we all will stop our videos. Only sir video will be, and Anandji, your video will be visible. Right? Now we are live, Anandji, so you can start.
Okay. Very good afternoon, all participants, doctors. Myself, Anand Kumar Jha, Zonal Head from Kedla Pharmaceuticals. I welcome you, Dr. Saab. I also welcome our Sandeep. He has joined from head office side. Welcome you, Dr. Saab. Welcome you, Sandeep. Bye.
Yeah.
Sir, thank you so much for joining us for today's webinar. We spread awareness about rabies, which is fatal disease, as you know also. But can we avoid it once appropriately vaccinated? This is an initiative from Kedla Pharmaceuticals through its innovation to serve the society and mankind. Sir, today's our topic is dose reduction strategy in rabies management and role of novel vaccines. Dear doctor, rabies is first 3 dose world first 3 anti-rabies vaccines. Sir, rabies has successfully completed 1 year with more than 40,000 animal vectors being used and vaccinated. Sir, 100% compliances were recorded and no cause of adverse effect registered, sir. With this, it is my honor to introduce today's speaker, Dr. Nitish Garg, sir. He is MBBS, MD, DNB in Gastro. Now I will request Dr. Nitish Garg, sir, to start the session. Over to you, sir.
Yeah, thank you for such a warm welcome. And let me just share the slides here. Okay, can you see the slides now?
Yes, sir. It is now opening, sir.
Yes, sir. We can see the slides now.
Okay, great. Okay, so let us start the program. And today we'll be discussing about rabies vaccine and its management, the role of novel vaccine. So, what all we'll be discussing today? What is rabies disease? What are the animal bites incidences in India? What is the epidemiology? How the evolution of rabies vaccine occurred? What were the challenges that were faced? And what is the unmet need? And why was it required to introduce a new vaccine? Because as we all know that rabies vaccine have been available since a long time, but why was the need to develop a new vaccine? So we'll be discussing all those things in the next few minutes. So this is just a structure of rabies virus, as you can see here. Rabies is a zoonotic disease, that is, it is transmitted by animals, and it is caused by a rabies virus. Virus is encoded by 5 structural proteins, as you can see here: G protein, N protein, P protein, M protein, and L protein. And it is a RNA virus, so there is a RNA inside, and then the outside capsule is called envelope. So as you can see here, when we talk about rabies deaths per year, approximately 59,000 patients or individuals die of rabies every year. Out of that, 1/3 are in India, approximately 20,000 rabies deaths per year. Out of those 20,000, approximately 91% of patients die in rural areas. Rabies is 100% fatal, but it is 100% vaccine preventable disease. And as you can see here, the first vaccine was introduced in 1885. Then it was derived from the spinal cord of the dog, and it was a live attenuated vaccine. And it was a cumbersome exercise because approximately 31 injections of increasing immunogenicity were had to be given to a patient who was infected of rabies. And then the newer vaccine came in 1911, which required 14 injections of a standardized dose of 0.5 ml daily. And then in 1976, that is almost 60 years back now, 60 years back now. So it the cell culture vaccine was produced, and that was an inactivated vaccine, which required 5 injections of 0.5 to 1 ml based on whether it's pediatric or adult dose. And the regime was fixed at 0, 3, 7, 14, and 28 days post exposure. So, what were the current challenges? What we had was these are cell culture vaccines, so they have inconsistency in potency. They have to be more stable because, of course, it's a cell culture, so the stability is one issue. Since it's a cell culture, so it has to be grown in the lab, and many times it becomes a short supply, and it also has a adverse effects, some reactions, so which can occur with the current available treatment or the current available vaccine, which is the cell culture vaccine. And when we see here, so non-compliance is a major issue, and there was a study done which showed that there was a decreased compliance beyond 3 injections. Now, how is Cadila helping to meet the unmet need? So this Threbis, this is the recombinant rabies G protein vaccine. It is the first protein subunit vaccine. It is prepared from the virus itself, and it's a RNA recombinant vaccine. It is prepared by the virus VLP platform technology, which we'll be discussing later. What is it? It's the only or the first vaccine with a 3-dose regimen, that is 0, 3, and 7 days. Because of that, it has a better compliance and it is convenience. Because we don't need to reconstitute it. It is available in a constituted form. Now, when we talk about VLP technology, so what is VLP? VLP is virus-like particles. So virus-like particles, they are just protein complexes which exist as nanoparticles. So from the native virus, because G protein is difficult to stabilize, so G protein is isolated using the nanoparticles. Then these nanoparticles are similar to the native virus particles, but they do not have the viral genome. So this genome, this RNA is missing, but the G protein is there. Since the RNA is missing, so they cannot replicate, but they can mimic the viral antigenicity without being pathogenic, and they are capable of inducing a strong humoral and cellular immune response. So this was a study done, and this is the original research article which was published in APCRI journal, that is Association for Prevention and Control for Rabies in India. And they studied this vaccine. So there were 2 trials done. One is the phase 2 trial in which different regimes were tried. One was 10 microgram for 2 doses, 0 and 3, and 10 microgram 037, and other one was 50 microgram 03 and 50 microgram 037. And all of this was compared against the cell culture vaccine Rabipure, and that was 037 14 28 days. And as you can see here, up to 90 days, the results were same of these 3. However, when you see here on 6 months, that is day 160, This gray one is 50 microgram 03. It had a sustained response. Yellow one is 50 microgram 037. It had a sustained response. And Rabipur had a sustained response. So these two were out of the study then. And then further on day 270, 50 microgram 037 had a sustained response or had the maximal available response, and others had gradually started declining. So they had decided that 50 microgram 037 should be the dose given to patients who are for post exposure prophylaxis. And then there was another article. This is the phase 3 trial, which had safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. And this was a phase 3 clinical study which was published, and it had total 800 subjects, which compared the 037 regime of 50 microgram and 037 14 28 days regime of Rabipur. And what was the study objective? Was to demonstrate non-inferiority of the test vaccine to the comparator vaccine. So it's not like they are saying that it's better, but it is non-inferior. So it's the same thing. If you use this or that, it's the same thing. It's non-inferior, but the compliance and all those things are better. So primary objective was seroproduction at 14 days post first dose, and secondary objective was seroproduction at 42 days post first dose of test vaccine. And these are the results. As you can see here, Travis and Rabipur adverse effects were low with Travis. P-value is not significant. Local adverse events also were low with Travis. As you can see here, with Rabipur, pain was more, redness was more, swelling was more. And systemic adverse effects also were like fever was low with Travis, but some patients complained of ear pain, headache, urticaria, and some patients had headache. So this headache, of course, Rabipur has more headache as compared to Travis, but urticaria Travis didn't has, but Rabipur does not have, and ear pain also Travis has, Rabipur does not have. And when we talk about seroproduction, so seroproduction was 99.24% on day 14 and 98.69% on day 42. So overall, the observed difference, the difference was 1.52%, the 95% confidence interval of -18 to 4.17%. So it showed that non-inferiority for seroprotection, that is primary endpoint and the secondary endpoint, both were met. To conclude, Travis was non-inferior to the reference vaccine. There were less adverse effects compared to the reference vaccine, and it's a novel 3-dose Travis. It was found to be safe and immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. And these were the awards which have been bagged by the brand Travis. One is the Pharma Innovation of the Year by Economic Times and the Golden Globe Tigers Award. Malaysia for the Innovative Product of the Year. Thank you.
Thank you, Dr. Garg, for a very interesting and this presentation, and the way, sir, you have explained the entire presentation is really good, sir. So we have right now more than 35-40 participants who are live, sir, and I request them to put their questions on the drop column, because we have just below the screen there is a place where they can put the question, and straight away we can ask the question to Dr. Nitish Garg. So by the time, sir, Nitish sir, we can get the questions. A few things I want to understand, that if you have some clinical experience related to rabies, if you want to share with the group, it will be very, very informative for all of us, sir. So over to you, sir.
Yeah, generally, what I have found in my patients whom I have prescribed Travis, Generally, it's a well tolerated, and people are still under the dilemma that they don't know. They don't know basically that a newer vaccine is available to them, and they can have a 3-dose regime because generally it's a standard practice, and it has been going on from past more than 50 years that there's a 5-dose regime. So it's a new thing for them that in 3 doses I can be protected of rabies. So that is one good feedback which I get from the patients. And apart from that, I did not have like any adverse events or any other problems uh, with the patients who had received therapies. So in that way, yeah, it is good.
So
And
major
then
thing, sir, what about the compliance, doctor, your dog bite victims can say about the compliance part if you talk about 5 dose versus 3 dose. So
compliance, of course, 3-dose compliance is much better. But then if we see like see everyone knows that rabies is a fatal disease. Everybody knows that. Almost everybody knows that rabies is a fatal disease, and if we don't take rabies vaccine, you may die. So that fear of death is very big, and people do take complete 5 doses. Uh, Compliance with 5 doses also, if we counsel the patients, it is good. But of course, 3 doses much more convenient and much more safer, as we can see as we had discussed in the previous slides.
and any feedback, sir, your patient must have given to you after taking therapies, like if you talk about my previous webinar just now we have concluded. So one of the doctor was, he was sharing his experience that one of his animal bite victim, he came to him and he was a businessman. So you used to go for the travel and other purpose. He said after taking this, within a 1 week, the
Hmm.
vaccination was completed instead of waiting for entire month. So
Yes, yes.
yes,
Of course, all those things are there. There is a less man-hour loss. Patient has to go leave his workplace and
right,
then go get the medicine, get it injected. It
right,
takes time. It takes time, and there's of course, a financial loss also available associated with that.
right, sir.
Uh, when we talk about 3-dose regime, it's a much more compliant way to go about it because it's of course it's equally effective. It's non-inferior, so there's no doubt that it is not working. And best part is it's a 3-dose regime, but
Right.
we have to sensitize the doctor community. We have to sensitize the patient community also. We have to sensitize the general public that
Right.
if there's any dog bite, then go get a vaccine. And maybe I think Cadila can publicize this like it's a 3-day regime, so like a 1 week regime, 3-dose regime.
Yes,
So if you can publicize like that, then I think people also will get to know about this.
absolutely.
And once the availability is good, then patients will switch over to a 3-dose regime.
Absolutely. Sir, in terms of, as you rightly mentioned that Cadila, yes, sir, we are committed to the motto, the objective which Government of India has also taken to eradicate rabies by 2030. That is the slogan
Yes,
also from APCRI. We just concluded in Lucknow last week. So
yes.
yes, Cadila is also committed in that and aligned to that motto. And if you talk
Mhm,
about 3 dose and if you talk about the awareness of rabies, so today, if I tell you, across
mhm,
India, we are having these 50 webinars at one time. So,
mhm,
and many of the doctors, they have joined and they're participating in this webinar. So this is just one step to increase the awareness about our 3 dose. As you rightly mentioned, we should take this advantage, initiative to
yes.
give more of the knowledge, not only to the patient, but even to the
Mhm,
medical fraternity also. So that we are
mhm,
doing. Apart from that, sir, we are also having this poster campaigns right now, which are going on, patient education posters, where more than 30,000 clinics we have focused to give all the poster campaigns in regional languages,
mhm.
creating awareness for rabies and 3 dose, sir. So these are the few initiatives we have already taken. And we hope that, after this is just a first step of this webinar. Every month we are planning to have such webinars across
Mhm.
India so that we can spread the awareness. So
Okay,
this is
great.
what I thought that I should discuss with you. So first of
Yes.
all, sir, thank you so much once again. And there are many
Yeah.
participants. Sir, one question has come. What
Yes.
are the sign and symptoms of rabies? One of the doctors is asking some signs, symptoms.
Signs and symptoms of rabies. So basically, how do we know? How do we know that the patient is suffering from rabies?
Right.
As we know that photophobia or hydrophobia. So these are the things which are publicized more. But the first symptoms are actually similar to any other viral disease. First symptoms are generally this fever, headache, some generalized weakness, discomfort. So all those things can occur, but gradually they progress
Right.
and can present with anxiety, can present with hydrophobia,
Yeah.
can present with altered behavior.
Right.
So these are gradual progressions,
Right.
and it takes time
Right.
because rabies virus can remain dormant also in humans
Right. Sir.
for a very long time.
Absolutely. Sir, one another question has come that what types of animal bite cases you come across apart from dog bite cases? Any other animal bite cases?
Yeah, there are a lot of monkey bites in our area.
Right. Sir.
Monkey bites, cat scratches,
Yes. Sir.
bats.
Yeah.
So all those things are there.
Right. Sir. So usually, like majorly it is dog bite, but predominantly it is a dog bite. But yes, monkey bite, dog and rat. Sorry, monkey bite. Then
Cat
cat bite.
scratches
Yes, sir. Yes, these are very
and bats also are there.
absolutely.
Yeah.
Right, sir. Sir, any other message before we conclude our webinar? Can you do have any message for all of us as from the medical?
No, just I wanted to say that I think it'll be good to sensitize everybody as we already discussed.
Yes, sir.
Sensitize the medical community as well as the general public,
Right, sir.
so that this disease can be prevented, because it can be prevented 100%.
Yes, sir.
If the vaccine is given on time,
Yes, sir.
then rabies can be prevented.
Sure.
But if not, then it's 100% fatal. So it's a double-edged thing. But we can end rabies if there is enough awareness about the disease and about the vaccine.
Sure. Thank you so much, sir. I would like to, say Mr. Anand Jha to please give a vote of thanks to Dr. Nitish Garg before we conclude our webinar. So over to you, Anand ji.
Okay. So sincere thanks, Dr. Saab, Mr. Saab, giving your valuable time as a speaker, sir, for today's webinar. Really, I pay thanks from core of my heart, sir. Not only from my side, but also entire Kerala team is thanking you, sir, on this board, sir.
Yeah.
And shortly, sir, we are going to meet with you, sir. Sir, I will convey my message that from left to right, in our community, we are taking the awareness clinic to clinic, hospital to hospital, sir. Sincere thanks once again, Dr. Saab.
Thank
Very
you.
soon
Thank
come
you so much.
in your place, sir. Thanks a lot.
Okay.
Thank you so much,
Thank
sir.
you.
And
Thank
thank
you.
you all of you who have actively participated, sir. We have got questions, and even right now, if you see the link, more than 85 people are live. So I also thanks all the participants who have
Absolutely.
yeah. Thank you so much, everyone. Thank you, sir. Nitish,
Thank
sir.
you. Thank you. Thank you.
Thank you, Anand ji.
Thank you.
Everyone. Thank you. Thank you. Bye.
Okay.
Bye.